Nick is a philosopher of mind and cognitive science who describes himself as an interdisciplinary philosopher, and really looking at his biography, one has to agree. I mean, extraordinary career, starting in mathematics, ranging across experimental psychology, a period spent as an intellectual property lawyer or barrister, is that correct? And now a distinguished philosopher of mind with particular interest in metacognition. So Nick's going to give us our next talk with the title, Self-Knowledge and Acting and Deciding Together. Nick, thank you.
So thanks for the introduction, Gareth, and for not saving my blushes. And thank you very much to Shea for inviting me and for putting together this day. As Gareth said, I've done some interdisciplinary working, and I know that it's a lot of effort putting a conference together, but it's one step up again putting together an interdisciplinary conference and trying to select people who are talking about the same thing, often in different languages, from different perspectives, and getting them together to talk to one another. So I think it's a very exciting thing that Shea's doing, and I'm very grateful to be part of it. So I want to talk about one little aspect of self-knowledge, as Gareth flagged, about metacognition. So we have self-knowledge, as Tony has mentioned, about all sorts of things that are related to illness and to health, about our own characteristics, about our personality, about temporary things, what state we're in, are we hungry, are we tired, maybe about how others see us, are we seen as trustworthy or dishonest, and in particular about our own mental states, about our beliefs and our desires. And for all of these things, although we're aiming at self-knowledge, we can fall short. It might be that we have a belief that's not true, so it doesn't amount to knowledge. So I'm not interested in the knowledge case especially, but this process of attributing these things to ourselves. And amongst all these things that we can attribute to ourselves, I want to focus on those that are at the meta level in a specific sense. I want to focus on ones that are meta-representations. So they're thoughts or cognitions or desires. They're kinds of representation, but they're about other representations, other representational states that we have. So, for example, I might have the belief that I'm 6 foot tall. So in that case, you can see I'd be a bit deluded if I had that belief. So that's a belief that's about myself, but it's not meta-representational. It's not about one of my representational states. It's just about my height. But I can also have the belief that I want to be a doctor, say. And that is meta-representational because it's about another one of my representational states. It's about my want, my desire to be a doctor. So I'm focusing particularly on those, the meta-representational. The most obvious cases are the ascription of beliefs and desires to ourselves and to other people. But also there are all kinds of ones that go by more quickly. So we're constantly assessing how sure we are about things. Are we a bit uncertain, or are we certain? As Shea pointed out, this was a central bit of the Socratic method, to realize that we ought not to be so certain about what we take to know. And that can go on implicitly. So think of the case where you can't see very well, and so you just adjust your position. So that's some process, probably not you explicitly, but there's some process that's keeping track of the fact that you can't see very well and changing your behavior as a result. So that's a kind of implicit metacognitive process. It's keeping track of how one representation is doing, how your line of sight is going, and it's adjusting your behavior in the light of that. So the first thing I want to put on the table is that these kinds of implicit metacognitive processes are going on all the time within our psychology, within our cognition. And then that might seem like changing the subject, because we've started with insight and the kind of things that go on in illness and health when we talk about our condition, when we convey to others what we're feeling or what health state we're in. Looking at these kind of low-level, often implicit metacognitive processes look like quite a different thing. But I'm putting those on the table for a reason, because I want to say that makes the explicit case a lot more puzzling. If we've got these implicit metacognitive processes going on all the time, often below the level of awareness, it raises the question of what's the point of the explicit stuff. And I want to put forward a certain hypothesis about that. So I'm going to try and be relatively quick to leave lots of time for questions, but there'll just be these two sections. And the first bit raises this puzzle about what the role of explicit metacognition, about the telling oneself and telling others about our mental states is. What's the role of that, given that there's all this implicit stuff that seems to go on very easily and automatically? And I'm going to suggest that reflecting on that raises a hypothesis that we should take very seriously, that its central function isn't in controlling oneself, although it can be used for that, but its central function is in acting together with others. It's social. It has its home in us as social creatures that decide together and act together. And that once we see that the kind of explicit metacognition that's the central focus of these 2 days could have its home in acting together, that gives us a slightly different perspective on what it's like and how it should work. And then in the second part, I want to just make some suggestions about how this different perspective could make us think about various kinds of illness. So I want to get my acknowledgements out early to make sure they don't get swept under the carpet at the end. The first part comes out of joint work that I've done with Chris Frith, Dan Bang, Celia Hayes, Nick Young, and Annika Bolt. And the second part, you'll see it, I've just got some very preliminary thoughts, but I've been very influenced in formulating those thoughts by Tony, who you just heard from, Shea, and from Gareth, who's been introducing us. So thanks to all of those for help in thinking about these issues. So first off, what is metacognition, this subset of self-knowledge that I'm interested in? So I've said that meta-representation is a representation that concerns the content of another representation, like a belief about what I believe, or a belief about what I value. And then by metacognition, I mean cognitive processes that make use of these kinds of states, that make use of meta-representations. A side note for philosophers, so in philosophy sometimes we think of cognition as a special kind of psychological process and we distinguish it from perception and other kinds of psychological processes. I'm using cognition in the sense that it's much more commonly used in the cognitive sciences that just covers any cognitive process. So any bit of psychological processing that makes use of meta-representations, that counts as metacognition for me. And that kind of thing, I think, is going on all the time, and there's some very obvious explicit examples. The Socratic one is a good one just to hold in the front as an example. In a case where I'm not sure I got the right answer, I can use that meta-representation about what I know or don't know to motivate another step. I go and ask for some help. That's something that I do, or I do some more thinking. That's a mental step that I might take. And I think that kind of thing is going on implicitly all the time. So there's a very famous experiment on how subpersonal processes make use of different sources of information. So the experiment just involves subject judging the length of a bar. And you can feel the bar and you can see the bar, and then you've got to combine those two pieces of information to make a judgment about how long it is. And the experiment manipulates how noisy the two channels of information are. So how accurate is the information that's coming in through touch, and how accurate is the information that's coming in through sight. And by varying both of those things, the noise on these two channels of information, you can see what subjects do, and there's a very reliable effect, which is very intuitive. People combine these two sources of information, and they put more weight on the less noisy source of information. So generally, in ordinary life, vision is a very non-noisy source of information, and we're all very vision-driven if we've got normal vision. But if you degrade vision enough, then the haptic source of information can be more reliable, and then subjects will put more weight on that in combining the two sources of information and coming to a judgment. That seems to be a perfectly sensible thing to do, and that's going on all the time, because in almost everything we do, we have to combine different sources of information. And that's an instance of the thing that I'm talking about. And then we start with this very broad idea of self-knowledge, but if we think of what's core that's going on here is representing something about another representation and then using that to change what you do or how your psychological processes work. This very low-level thing about combining information is doing just that. It's weighing the relative reliability of two sources of information and using that relative reliability to change the judgment that the subject makes and then how they act. So that's just one example, but there's lots of evidence that that kind of thing is going on in our psychological processing all the time. Let me make a rough use of a distinction that some of you may have heard of, the distinction between System 1 and System 2 processing. So System 2 processing is kind of higher level processing. It's the kind of processing that's the home of the paradigm examples of self-knowledge that we'll be discussing and we have been discussing. So it's the kind of explicit cognition, the ones that we communicate to one another, the ones that are part of the narrative of our mental lives. Contrast that with System 1 processing, which is fast, automatic, often goes on below the level of awareness. So I've been arguing that there's lots of System 1 metacognition, things that deserve to be thought of fully as metacognition, but they're just going on in a system one way. And here's a kind of picture of that. So information's coming in through perception. We've got to constantly decide instant by instant how to act, and that involves weighing the different information and weighing our different goals. There's a very simplified picture of that, but the thing I'm trying to get in this picture is that these meta-representations play a role in this process of deciding how to act instant by instant. So I gave you the example of weighing different sources of information by their variability, by the noise. So all of that can go on in system one. So there are lots of examples of that. Subjects, when they're having to make choices, they show post-error slowing even without being given feedback. So having made an error, that will slow down their behavior in a way that they're often not aware of without being given any feedback. Subjects are able to inhibit responses to stimuli that they're not conscious of because they've been masked. Subjects can respond to the changing difficulty of a task even when they're not aware of the changing difficulty, but you can see it in their behavior. And even in non-human animals, you can see the signatures of this kind of system one metacognitive processing. So, for example, information seeking in simple behavioral tasks given to rats or macaques betrays the fact that there are these kinds of monitoring processes going on that make use of the properties of other representations. So that's a kind of almost ubiquitous set of systems. But we've also got this explicit thing. I mean, we talk about it all the time. It's the central focus of the next 2 days. I can realize that I might have got it wrong, and so I go more carefully, or I tell you about it. I can see that that student who's sitting in the corner of the lecture theatre is going to be distracting, and I can deliberately look away because I've reflected on what's about to happen. I can notice that the next step in the proof is hard, and so decide to spend more effort or more time on it. Or I can see that I can't see something clearly, and so I can explicitly decide to go and investigate it further. So the puzzle I want to raise is, given that we've got these systems within us that do this kind of thing automatically all the time, why do we go in for this explicit, time-consuming self-reflection that seems to be mirroring just the same thing? Why do we deploy our demanding, slow System 2 resources to do this task, which System 1 seems to be able to do in lots of circumstances, fast and effortlessly? So I think there's a clue to that in some experiments that have been done recently on relatively simple perceptual tasks, but those tasks done in a social context. So let me tell you about one of them. It's a perceptual decision-making task done by Barami and colleagues. So the task is just to look at some stimuli that are hard to discern and to make a judgment about them. The question is the first one that you see or the second one that you see the one that contains a bit of difference in it? And they're close to threshold, so they're hard to judge. So individual subjects, they're presented with these repeatedly. You can get it right a fair amount of the time, but you get it wrong a fair amount of the time. The crucial thing about this experiment is you compare what happens when people do it alone to what happens when two subjects are sitting side by side, each looking at their own screen, but able to communicate about what they see. And the finding is that if you let subjects communicate about these stimuli, they do better than they do on their own. So the slogan is that two heads are better than one. They do better than even the best one of them does on their own if they're appropriately matched. So they're putting together information in a kind of optimal way. And if you analyze how they're making use of information, there's some pretty good evidence that one of the key things they're communicating is confidence. So one of them saying, I really didn't see it at all this time. I think it's the first one, but I really didn't see. Another one saying, yeah, I've got a good handle on it this time, and it's definitely the second one. So there's those communications about the relative confidence about the judgment trial by trial that seem to be playing a central role. So it's very like what I said was going on internally when you weigh these two different sources of information, the haptic and the visual, but now we've got two people acting as different sources of information, and they're communicating so that they can weigh them in coming to their joint decision. So I think I want to argue that gives us a clue as to what the explicit metacognition is there for. So when metacognition, meta-representations are being formed internally within one head, then it's relatively simple for psychological systems to make whatever use of them they can. So if there's something useful that you can learn as a way of making use of this noise signal, then if it's sitting within your head, psychological systems can pick up and learn what to do with it. but it's much harder between two heads. So in the two heads case, these little meta-representations are sitting within each individual agent's head. So it's not a case where simple learning mechanisms can pick up on them and make use of them. Because if we're having to decide together or act together, some of the crucial information about what's uncertain or what's noisy is not in my head, but it's in your head. So my suggestion is that this process of explicitly communicating things like confidence and reliability is, at least as one of its central functions, serving the function of allowing us to coordinate between two different people when they're acting or deciding together. So the thing that's so easily within System 1 that goes on automatically without us even being aware of it, when two people are acting together, becomes more difficult and involves this communication, this broadcast of a signal about how confident I am, or what I think is unreliable, or when I'm uncertain, or when I need to know more. So I think it's very tempting, especially in our individualistic society, to think of self-reflection in primarily individualistic terms. We think of how well do I know oneself, know thyself, how well do I know myself? And we think of the central function of that to be to do with my regulating myself, my deciding what to do for myself, or deciding whether to find out for myself. I think it's very natural to think of that as the home of self-knowledge and the point of self-reflection. So I just want to turn the tables a bit and suggest that this puzzle about why we go in for this explicit reflection, given that it could all be done implicitly, should make us think that the communicative case is either the primary case or is at least a central case. That the function of these explicit metacognitions, which are the paradigms we're using for self-knowledge, but the function of those is social. And after all, we are a deeply social species. So if you compare us to all other species, we go in for cooperation much more than any other species. You might say that the eusocial insects go in for a very kind of obligate cooperation, certainly within a limited realm. But certainly within the mammals, we're more cooperative than any other mammal, by an order of magnitude. And we're obligate cooperators. So none of us could have any shot at surviving without the cooperation of others, the way that we're socialized into society. So I think that makes a reasonable evolutionary case that there's an evolutionary route to using these metacognitive representations communicatively as part of how we evolved to become a cooperative species. Joint action, doing things with others, has been a central part of human evolution for hundreds of thousands of years. And it's plausible that these communicated metacognitions about what we can see or what I'm unsure about or what I'm sure about played a central role in allowing us to cooperate in these rich ways. And then there's quite a lot of experimental evidence that we go in for that. So there's experiments, for example, on how people behave in juries. So you set up a mock trial and you have a mock jury and you see how jurors make their judgments based on what the witnesses say and do. And in that context, jurors put a lot of weight on the confidence that witnesses express when they're giving their testimony. And jurors are also sensitive to how reliable that confidence is. So how calibrated a witness is. That's to say, how good they are at varying the confidence that they portray depending on whether it turns out that they do know or not. So that's the kind of signal that, at least in mock juries, people are very sensitive to. Another area where this has been studied is in team sports. So of course in team sports communication is important, and it turns out that communication about confidence and certainty is something that's going on all the time in team sports. And of course, Shea's example of the Socratic method is a good example of this, that the method of doubt, of coming to realize one ought not to be as certain as one is important to the process of discovering, and that the process of discovering is a deeply social one. Right? If we want to find things out, rather than sitting on my own and just figuring it out for myself, a much more effective method is to say something to someone, and they ask a question back, or they say something back. This has been studied in the case of judgment and decision-making. So some of you will be familiar with the kind of basic finding that in all sorts of simple problems, like mathematical problems, estimating problems, and so on, people can be set up to give the wrong answer very easily. So you ask someone a simple mathematical problem, often people will give the wrong answer. And it seems that we give the wrong answer because we're using these simple heuristics to solve the problems. But if you give people those problems in a group where they can discuss it with a few people, then the group is much less likely to get the wrong answer. So I think there's some evidence in that line of work that the way that we communicate with others and discuss the answers to problems is a central way that we get things right. So both for acting, for hunting together, say, and also for deciding, finding out the answers to questions, the social case, the doing it jointly case, I think is a central one. Okay, that's the switch of perspective I want to suggest, and now just a few reflections on how that could give us a different perspective on health and illness. So two aspects in illness, one in all kinds of healthcare and another in mental illness. So if it's right that this process of discussing with others, signaling our confidence, is a central function of metacognition, then I think it gives us a slightly different perspective on the relationship between the patient and the clinician, and the relationship between the patient and the patient's relatives, friends, social group. So it's tempting to think that the patient is an isolated locus of decision. And of course, I think the patient's autonomy is absolutely central, but once we see that weighing confidence, weighing information is something that we do socially, then it makes the clinician's role in communicating the relative certainty of various diagnoses, the relative certainty of various lines of evidence, the relative efficacy of kinds of treatments, it makes that role look much more central. Because if you think the task is to decide socially what's best to do, and that the way that we've evolved to do that is to weigh different sources of information, not all of which are coming from myself, then the clinician in providing that information with its calibration is playing an absolutely central role. So I'm not suggesting that overturns autonomy, but I think if we think of decision-making as a social process, and that communicating confidence about that, and patients taking on board communicated confidence about that, if we think of that as central, it gives us a slightly different perspective. It also puts a different perspective on the values and pressures that patients are under from their social group, from their friends and family. Again, there's an entirely self-driven, kind of autonomous perspective where you think that's just all interfering. The patient ought not to listen to any of that. But I think if you have this perspective where deciding is a deeply social phenomenon, then it's part of a positive, functional way of deciding that one takes into account valuations, for example, from one's peers, from one's friends and family. Okay, so that's just a slight suggestion in the case of ordinary healthcare. And now I just want to mention a line of thought in relation to mental illness. But this is an area where I really don't have any data. It's just a suggestion that it would be an interesting place to go and look for more data. So there is some suggestions that in schizophrenia in particular, patients have particular problems with metacognition of the explicit kind, of the communicative kind. So for example, in a study that was done with a group of healthy controls and schizophrenic subjects asking for answers to ordinary kind of factual questions. What's the capital of so-and-so? How many such and such is such and such? Schizophrenics did just as well in answering the questions as healthy controls. They got as many right, but there was a big difference in the metacognitive measure that they were using, which is just asking, after answering the question, do you think you got it right or not? And ordinary subjects, healthy control subjects, were much more calibrated. Their confidence about their answer much more closely correlated with whether they did get it right or not than in the schizophrenic patients. So there's there and in other places some hints that there may be selective pathologies of metacognition going on in mental disorder. So I think that's something that's worth investigating, especially if we think that this explicit case, this communicated metacognition, plays an important role in joint action and joint decision-making. Because there, it might be that one of the things that's going on in the course of having a disorder and the course of the disorder unfolding with its distinctive course, is that patients are less good at generating and then weighing and taking on board these metacognitive measures in this explicit social process of deciding. So in illness, and especially for this case in mental illness, it can be important to weigh how much weight to put on one's own assessment of things and how much weight to put on the assessment of others, people that you're interacting with, your friends, your family, your clinician. So if it's right that there's a pathology in some mental disorders in the dealing with metacognitive information, then that can be a route by which we could find a pathology in this social process of taking into account the assessments of others. So that could be a route to the kinds of findings that Tony was showing you of poor insight. And that can be not just about matters of fact, so how confident should we be about these facts, how much should we weigh our own assessment about them against others, but also about what to value. So in the sphere of deciding what to value, there's the same kind of processes going on. So how much should I value these kinds of life outcomes? How much should I value the harms and benefits to my family and the harms and benefits to my friends? Those kinds of things are all the focus of also of metacognitive reflection. So the suggestion is that we can look for relatively psychologically tractable markers of metacognitive failings in taking on board or broadcasting explicit metacognition. So things that are going on with this bit of the system, either in creating these metacognitive representations, broadcasting them, or making use of the ones that are broadcast. Those are things that there are developing paradigms for studying how those work in healthy individuals. And my suggestion is that's an interesting place to look at in mental disorder as well. Because a pathology in that particular location could play into these, could be an explanation of and play into the facts about insight that Tony's been talking about. Okay, so let me just summarize what where I've tried to get to. I started with this very broad idea of self-knowledge as it relates to illness, and suggested that it's very natural to think about that. After all, it's self-knowledge. It's very natural to think about that as it applies to oneself, as it relates to working individualistically on deciding and on thinking and on acting. But when we see what's key about the metacognitive case, which is making use of things like reliability or confidence for the purposes of controlling thought processes or controlling behavior, that's actually much, much more common. That's almost ubiquitous in humans and in other animals. And it makes the explicit case that we start off look more puzzling than it did otherwise. I suggested a solution to that puzzle, which is that the social use, the communication, the joint acting and joint deciding is a key way that we're making use of the explicit metacognition. And I suggested that thinking about it that way both gives us a slightly different perspective, or argues for a certain kind of perspective in the case of the health encounter, the clinician-patient social group encounter, and also that it's something that's worth exploring in the context of mental disorder. So I'll stop there for questions.
Thank you, Nick. So a moment just for a few questions about your talk, and then Tony, perhaps you'll come up and we'll have a little bit of time for a panel. So any questions on Nick's presentation?
Hi, it's Fiona Johnson from UCL, and thank you for a very interesting talk. I was just struck when you were speaking that a lot of the processes that you describe are quite dependent on, firstly, people knowing what they don't know, having that correct assessment of what they don't know, and secondly, being willing to communicate it accurately, so being able and willing to communicate that. I just wondered what was your perspective on whether people can and do communicate uncertainty effectively.
So there's two aspects of that. I guess there's the ordinary case of joint action, and then there's what's going on in more pathological cases. Are you asking about both kinds?
Both, I suppose, yeah.
Right. So I think in the everyday case, it's mostly been studied in cooperative situations. And in cooperative situations, I think we've got reasonable evidence that people both have access to reasonably reliable but not perfectly reliable measures of, for example, how well they've seen something, and that they are motivated to communicate that. And in lots of other kind of cooperative game theory examples, we see that people are just incredibly motivated to give information of all kinds. So in the cooperative setting, people generally are super informative, and if they have access themselves to something, then they're usually kind of honest and trustworthy in communicating it. In the strategic case, it's quite different. So in the case where you're in competition with others, then I think it's quite different. So then when we get to the healthcare setting, or especially pathological cases, then it's less clear that it's a cooperative situation, and especially in some kinds of mental disorder, it's less clear that the patient sees it as a cooperative situation. So I think you're right. I was focusing on a pathology in being able to generate these things or being able to make them explicit, and I think you're suggesting, well, there's something else that's probably going on, which is that in a strategic situation, someone who can generate these things and could communicate them explicitly might have lots of motivations that are stopping them doing that. And I think that's right too. So I think it's important to get at if there's a kind of block in the effective communication of confidence information, it's important to get at what's generating it. Is it a motivational thing, or is it an absence of the basic information? So I think that's a good place to press.
Thank you.
Any other questions? Okay, should we take one, and then we've got one here, and then Tony, do you want to come up after that? Yeah. So we just stay here. No.
Thank you so much for talking about the social side of things. I just think it's really important, and there's lots of individualistic stuff. And as a clinician, then people do not turn up as individuals. They turn up, even if the other people are not in the room, there's loads of other people behind them. And not only behind them, I was just reflecting on when I talk to parents of young kids about what to do with their child having this, that and the other, and I'm often suggesting one particular internet resource to them, and I say a whole load of stuff. And as I talk to them, I show them what I'm looking at on the screen, and I say all of this stuff. I usually tell them first, and then I show them on the screen, and they believe it much better when they've seen it on the screen than when I've just told them it, which is always really interesting to me. But I was just interested in what you thought about different cultures as well, because different cultures have different attitudes to socialness and familyness. And so Kurds, for example, will say that a family is like a hand, and so that everybody in all the fingers are really important, and you can't be a hand without even your least functioning finger. So they'll have lots more ideas of socialness. And I want to know whether you'd had more thoughts about, not Kurds particularly, but the different cultures and how they approach that socialness.
I think it's an excellent question, and I know almost nothing about it. So I'm tempted to ask you to say a bit more, since you probably know more from your clinical encounters than I could contribute. I mean, so I'm suggesting that in the normal case, across cultures, it's always important to communicate confidence, and it seems to be very, very plausible that different cultures will do that in different ways, that social joint decision-making works very differently in different cultures. But I wonder if you think that it's plausible that that this business of weighing other people's confidence is important across cultures, despite the variations in how we come to a joint decision.
You mean,
across cultures.
what your question is, are there differences within, of course,
So
cultures
is it
meld into each other?
But so I'm putting forward the hypothesis that something at the level of communicating metacognitive information is important for joint deciding, and I'm wondering whether, even though there's this variation across cultures in how we come to joint decisions, whether it's plausible that other cultures are also making use of this metacognitive thing.
I think that some cultures, so I've worked a lot in Tower Hamlets, there's big Bengali populations there, and I've also worked in Hackney where they've got big Turkish populations, and there's different concepts about pain all over as one example, and so many clinicians would see the older isolated women with pain all over as having maybe some more psychological issues, but it's always presented as pain all over. And so I'm just thinking about different concepts of normality as well, I think is really important, and how that's communicated. And if there's no way of thinking about this as a psychological problem, then it's definitely painful. This is painful. So it may be conceived of as a physical pain, is one of the examples that I'm just thinking about.
Yeah, I'm sure there's a lot there.
Okay. Can I just give another example, which is about your communication thing? So when someone has a diagnosis, so for example, a serious diagnosis like cancer, then what then happens is that World and his wife have got ideas about what you should do. So I've got a diagnosis of multiple sclerosis, and people are always telling me as though, I'd never thought about it myself. There's no such thing as an internet. I've never spoken to a doctor, but they have the answer. And they tell me this earnestly, really annoyingly from my point of view, but with the best of intentions. And this is what you're talking about, the Uber cooperation thing. They are enforced, they must tell me something to be helpful. But I think doctors also do that, and maybe as a clinician then I should spend more time being silent rather than trying to help.
So this suggestion I have that we're constantly communicating and we're constantly having to weigh information, I don't think it suggests any easy solution. So as you say, in the ordinary case, people are communicating at you all the time, and we've kind of got some facility with ignoring some things and sorting the important from the unimportant. And if there's a pathology going on in important cases with being able to weigh people's confidence, then it's going to make this task much, much harder, given how much people are communicating at us all the time.
This would be a really good thing for medical students to be able to think about, although maybe it's a bit sneaky once you've worked out how to, because as an experienced clinician, then I know how to, so like I don't ever say that I know everything, and actually I know that patients like it that I say I don't know everything. They like that. I can see myself going up in their estimation when I tell them.
And of course that's central to the Socratic method. I mean, as a philosophy teacher, you're very aware that if you say very little, then anything you say about the subject is going to be incredibly influential on the student. So, you know, that's a power that you've got to be very careful with.
Exactly, you have to be very careful with. That's what I'm saying. It's a bit sneaky because you can really learn how to do this in the most sneaky of ways.
Okay, well let's ask Tony to come up and join the panel. Nick, should we grab a microphone? Actually, just as we're doing that, Nick, I was a question about culture. As a philosopher, you're interested in System 2 metacognition and drawing attention to the sociality or the social function of that. How does that sit in relation to the culture you know well in philosophy? I mean, because the man on the street's image of philosophy or philosophers is that it's solitary, isn't it? But it's also clearly System 2. It's a lot of slow, reflective, explicit types of processes.
Yeah.
Are you drawing on philosophy for your interest in sociality?
So I think
or are you having to get out of it?
I think philosophy is quite a good case. So it's a case where the thought of the person in the street is probably not very accurate. I think if you ask the person in the street, how does science work? People would say, well, people are working away in labs, but they're publishing and they're communicating. So I think there's this everyday sense that science is a social endeavor and it involves putting things out there and getting it criticized and then putting the next thing out there. And in fact, philosophy is just like that. The key thing for philosophy isn't the paper that's published in a journal where I've sat alone and worked out the answer. The key thing is the seminar, where you put forward a view and people respond. And people are sometimes surprised that we have seminars where there's an hour for questions. But really, the key thing in a philosophy seminar is the questions, where people put you under pressure, you think about how to respond, you go away afterwards and think about it for a week. So I think actually philosophy is an example of coming to understand being a social process, doing it together.
Okay, so questions on the session as a whole.
Hello.
Sorry.
Hi. Is this working? I think so. I'm Linda Miller. I'm a GP with an interest in medical humanities. I was particularly interested in your suggestion that the sharing of metacognition may be just the feeding back of the question. And I think this is something that I've learned as a clinician and as a coach, actually, learning health coaching skills. It follows on from the other comment earlier. It's actually very powerful just to feed back the question to somebody rather than overloading them with lots of my additional information. And they generally have lots of very sensible ideas about what their condition is and what they should be doing next about it. Was that something that you deliberately drawn out?
Well, so it's not something I've got any data on. It seems very plausible. Maybe I could throw it to Tony. Is it something that is common in your clinical encounters? The feeding back of a question as a part of the therapeutic process?
I think that is a very common technique. It's sort of, I think of Carl Rogers as being the exponent of that sort of approach. And I suppose it is about aided self-discovery, if you like. So it definitely is about a dialogue, but it's about, but the idea is that there is still something that discovering something for oneself has a very powerful educative function, and again, being slightly sneaky, helping someone discover something for themselves seems to be a very good way of teaching and helping.
It's very empowering that the listener actually has the belief in the person speaking to generate their own solutions. I think it's something we should be definitely teaching medical students. My other question was about stigma, basically. How much does stigma play into the experiments which related to people's expression of their level of insight, really?
Yeah, no, I think that's a very important element, so that the view of others, the way other people see oneself can be positive or negative, or we can imagine that the way other people see us is very negative, which I suppose is what stigma is about. So it's not automatically positive. The people aren't automatically working together. I think Nick alluded to this, that where there's an explicitly cooperative setup, 2 minds or 5 minds are usually better than one. But when it's 4 against 1, or perceived to be 4 against 1, that is very, very demoralizing for the one person. So, and it makes the individual generally averse to other people's views. It makes them cut off from other people's views. It makes them defensive, if you like. So I think the way we share information, especially when we're talking about something in an individual which is about their vulnerability, we have to be very, very careful to not trigger defensive reactions. And I think sometimes the terminology that we use in good faith about trying to help someone see their predicament in terms of illness can be perceived as very stigmatizing, and that's a big issue for psychiatry, I think.
Can I follow up on that? So you had this, you'd been looking for a difference between the high insight and the low insight patients and didn't find it. And then that keys into the question that was asked earlier. Maybe the difference isn't at the level of having it available, but the motivation to communicate these things, like communicate my own assessment of my psychological or psychiatric condition. Was there any evidence of there being a difference between those groups in whether they saw the clinical encounter cooperatively or competitively, strategically, with the poor insight ones? Did that correlate with the people who were defensive and thought they had to defend themselves, and the high insight ones go with the ones who thought the clinician was trying to help them and saw the whole thing as a cooperative endeavor?
Well, that wasn't looked at specifically, but I think it is inherent in that, in the idea of poor insight. In a way, when we call a person, we say someone has poor insight, and that's often criticized as being in itself a pejorative thing to say. But it does encapsulate the fact that people, the patient and the doctor, are slightly in opposition. That there is a lack of trust. There is some failure to have some shared body of knowledge. So in a way, that's the problem, right there at the beginning.
thought, Tony, what was some of that data you showed on, this was a group of people for whom insight is often discussed and debated most, which is people with schizophrenia. That you showed that data and in fact showed them as rather fair-minded on attributions and self-referent and so on.
Yes.
That seems like a very important message, actually. There's a danger perhaps not to be fair, actually.
Yeah, I think when the person with a serious mental illness who's saying, I don't think I'm ill, they're not really doing it strategically. They're not doing it to avoid something. That's how the world looks to them. And I think that should help clinicians be much more sympathetic and, in a way, admiring of the individual. That's the way they see the world. They're not trying to pull the wool over your eyes. I think one thing, if I can take up about the idea of cooperation, is that there is still a myth about the individual who everyone said was wrong, and then eventually they're vindicated. They stuck to their ideas. They didn't listen to what everyone thought, and sooner or later the world agreed with them. And it may be that that is a myth, and it hardly ever happens, but it's a very, very powerful one, and it argues against always collaborating, always listening to people who seem to think they know the answer.
Sherry, we're running, I think, up against time now. Is that right? We've got another session to fit in before lunch. So I'd just like to end by thanking Nick and Tony for giving stimulating talks this morning to us.